The next panel, I'm really excited to introduce another panel on transformative partnerships. I do think that's the quickest way for us to get to effective healthcare solutions. So we are really trying to look at more and more creative models around that. The next panel is healthcare companies that have been doing partnerships of different sorts, and I want to introduce the moderator. As she comes up, they're getting mic'd. It's Karyn Skultety, and she's VP of Health Services, Institute on Aging, and we're actually just entering a partnership with them in our geriatric house calls program, and they had a very nice conference here on campus last week, or the week before last. The panelists are going to be familiar to you, in particular Karan Singh, who's a co-founder of Ginger.io, and we have many partnerships with them on campus using their fine aggregator visualization dashboard processes, and even in my own department in orthopedic surgery, but many others as well. Go ahead and come on board. And then Dickon Waterfield, a commercial lead in Big Health, and he is also in discussions with some of our researchers. So the partnerships on our side come in various forms, and they're going to talk about not just our partnerships with them, but a variety of others. So perfect timing.
Great. Well, thank you so much for having us and having me here to moderate the panel. I told these guys that I have the easiest part of the job. Although we do have the most difficult placement in that we stand between you and lunch, which is always an interesting place to sit in the conference. So you were both described in our brochure on the conference today as representing two of the most prolific and innovative startups out there. So I'm going to give you a chance to just quickly introduce yourself and talk about what each of your startups is doing. Dickon.
Sure. So Dickon Waterfield, commercial lead at Big Health, which means I lead on partnerships, business development, and sales. So Big Health is a digital medicine company. We create evidence-based behavioral medicine programs. Our first product is Sleepio, digital sleep improvement program, clinically proven to help overcome even long-term poor sleep. Features a full course of cognitive behavioral therapy for insomnia, tailored to your specific goals and needs. But crucially, designed to feel more like entertainment than medicine, right? So the whole program is presented by your virtual sleep expert, the prof, and his narcoleptic dog, Pavlov, okay? So our focus at the moment is actually working with large self-insured employers. We've been using some of the evidence that we've developed in the clinical setting. So we did a randomized placebo-controlled study to actually demonstrate that the program worked as our starting point. And we've taken that into large self-insured employers such as LinkedIn, Henry Ford, to help their employees improve their health, happiness, and productivity through better sleep, because we think that's a really destigmatized way to address a whole host of issues that they currently wouldn't address otherwise. So, quick intro.
Thank you.
That was a good story. I liked it. I don't know if I'm going to beat that. But hi, everyone. Co-founder at Ginger.io. Real pleasure to be here. We've been working with the team, actually the Healthy Heart Study, and about 4 or 5 other now partnerships around campus. So excited to chat. We focus in mental health as well, really digital therapy for mental health patients, enabling them to self-manage and connecting them with their care teams to deliver more effective care. Our twist on this was 10 years ago. My co-founder was getting his PhD at the MIT Media Lab and discovered that we could predict health state based on how you use your smartphone. That based on past data we can collect from your smartphone, we can infer how you're feeling. And particularly in mental health, where there isn't an HbA1c for depression, there aren't objective measures for understanding behavior. That could be a really powerful insight to delivering the right intervention to the right patient at the right time. And so what we did, and I think part of the reason we may be here and talking about this story is, we came out of the lab. We recognized that in order to sell and be in this space in healthcare, you needed to prove your value. And so we've run a number of clinical studies that align against the triple aim that demonstrate not only cost reductions, just published a paper around 50% reduction in utilization, but also clinical quality improvements. And we've now worked with about 8 out of the 10 largest academic medical centers, but I can safely say that UCSF has been our favorite. We've run about 20 IRB studies, so have a lot of experience, but also battle scars in how do you work with the system and sell to the system at the same time.
Will you be revealing who your least favorite was as part of the panel?
I probably won't do that. You may guess.
So let's start with the issue of stigma a little bit, and let's take a look at it from two different sides. Part of what I'm always happy to see is mental health being featured at conferences, because I think it's easy for it to be left out of the conversation when we talk about health. But let's talk about the stigma from two perspectives, both from the side of people in the tech or digital side of the world shying away from mental health. But let's also talk about the role that tech, sometimes the reactions you can get from the mental health side of the world in utilizing technology and how that's played into your work.
Yeah, I mean, to take the first one of the stigma around mental health, I mean, I think broadly speaking, the world is still not comfortable talking about mental health issues, right? America's actually far advanced from many other cultures, right? I come from the UK. We never say how we feel, right? Totally repressed. We pick safe topics like the weather, right? As a starting point. But, I mean, the reality is we address that through sleep because we think it is a great destigmatized topic. People are happy to talk about it. Everyone's got a wearable tracker probably on them in this room right now, right? So they're talking about their sleep regularly. So that becomes a really interesting, easy way in, right? We think about it as the canary in the mine shaft, right? It's one of the first things that goes. So if you can get people to address that, you can get them in to open up to a whole host of other issues, right? So that's one of our ways.
Great. What'd you say?
It's a big problem. I mean, 60 million people in the US alone. We see it play out, probably most importantly, just from an access standpoint, where 80% of people don't actually receive adequate care. The average wait times are weeks, if not months. With the Mental Health Parity Act and as part of the Affordable Care Act, just demand is through the roof. So as a result of coverage, I don't think the stigma has been reduced. It's still there, but people are looking for easy, convenient, safe, private ways to get support, and things like the Sleepio program, what we're working on in a program called Mood Matters. They're convenient, and they actually have been proven to work. And so it's starting to change the dialogue. I agree with you that it's unique. I actually just got back from a conference where they had a panel on behavioral health. We were actually talking about it. Yeah. But the flip side too, it's really interesting because even on the provider side, there's a stigma around whether it's primary care docs actually having to deal with it, but now needing to deal with it, whether it's even in the behavioral health settings or therapists who are now thinking about how to use technology and measure their success when that wasn't necessarily always a part of the equation. So changing quickly.
Definitely. So partnerships become even more key, particularly with the stigma piece, and also that we've got to attach what's going on in health to mental health and not have those two things sit in different worlds. So talk about some of your experiences in trying to partner some of the good, the bad, maybe save the ugly for the beer portion of this later in the day.
Fair.
We were talking about this just as we came up. Partnerships are hard, right? I think is the first part that we would say. We always think about it in three ways, right? It's got to have three things. Real commitment and desire from both sides, right? If there isn't a commitment and desire to make it work, if one side really wants it, it's not going to happen, right? Then have you got the resources behind it? And then finally, just is the goal aligned, right? So those are the ways that we start thinking about them, and from there you can build. I'm sure Karan would agree. But.
Yeah, no, I would say it was trial by fire very early on. We didn't know what we wanted to be when we grew up. We had this new microscope, and we could measure how people were doing, and we worked in a lot of different disease states. And the world has changed a lot. And I think when I think back about, the advice I would have given us now would be maybe to point number 3, and that's probably one of the most important for us, has been just being really clear about what good looks like, what success looks like, what are the metrics for success. Yeah. We now sign performance-based contracts where we outline these are the outcomes we're looking to demonstrate. When we demonstrate these outcomes, here's what comes next. So you don't actually have to negotiate multiple times through that process. And so really being clear, if it's a research study, what is that path to success? And success could be a publication. If it's a commercial rollout, what is the path to broad-scale deployment? Because I think we've had to walk away from a number of deals where we realized, having gone through that discussion, we weren't aligned There wasn't the commitment. Saving money in one part of the house actually meant losing money in another part of the house. And so that was a hard reality, but actually being really explicit and being very specific about the outcome measures and simplifying them and just choosing one, if not two, that we're all gunning for, has helped us a lot, at least in the last year or so. But something that I think we learned early on, obvious in retrospect, but we learned early on to spend a lot more time in working through that.
Can you give an example of a particularly successful partnership and what that outcome looked like?
Sure. Well, we're working with, I can.
You can't say
give
no,
on both sides,
so,
yeah. We are working with the team at Kaiser. It's been a great partnership over the last few years. Actually, they participated in our last round of financing as a result of working together through this. But I would say we didn't get it right early on. We learned through the process because both sides actually were trying to discover what it means to integrate digital health into the mental health system. And now we have a good path towards, we've outlined a specific set of outcome measures related to patient activation, related to clinical outcome improvements, particularly around the PHQ-9, and ultimately related to utilization, how much this sort of approach can actually reduce load in the system. And we've really spelled those out much more explicitly and have gotten alignment there internally in a couple of the different groups in which we're working, so to scale that effort. But I think it is something that being really explicit about and putting it in writing can help go a long way.
What would you say for
definitely.
your successful?
I think our most successful ones have actually really been about the research. So take actually a clinical provider in the UK. They actually came to us because they weren't happy with their existing mental health solutions for treating patients with anxiety and depression online. And that sort of flipped it. They came to us, they had a very specific need. They wanted to offer our program to their patients. So when we spoke to them and met them, the actual team that was responsible for implementing it was driving the need from the company, right? So that made it really easy to partner with them and to sit there, and we spent a lot of time up front training them, right? Training their team on our program, the relationship between sleep and poor mental health, the evidence behind CBTI, and from that, we ended up with a fantastic program where what's actually been really valuable to us is the research that's come out of that, because we've been able to demonstrate that by focusing on sleep, you can obviously reduce insomnia, but the impact that has on anxiety, depression is huge, right? Yeah. So recent evidence has shown that actually sleep can be a really important target. Yeah. So that's what we found. So having them come to us has been super helpful.
Yeah, and maybe just to add to that, a question for you too. One of the challenges we've had sitting on the other side of the table has also been, and I think Dr. Blum and Dr. Marquez from the Healthy Heart Study described as well, is for each party to take advantage of their own superpowers and to really understand what they're very good at. And I think early on when we talked with a lot of academic medical partners in some of these research studies, there was a tendency to want to co-create, to want to build technology solutions, and that wasn't necessarily always the right path. It has been in certain contexts. I think the Healthy Heart team here at UCSF has done a phenomenal job of pulling together a back-end web dashboard and integrating all of the different data sources they have. They also had a lot of great financial commitment and funding, but that's not always the case. So I'd be curious, I don't know, at least in a lot of our research partnerships, I think when it's worked really well, it's bringing the clinical expertise to the table that a lot of these research partners can really provide a lot more of the reality on the ground and an understanding of what are the outcomes we need to measure, what's the path towards publication, how do we make this a really rigorous relationship, and then bringing the technology, the user experience, the design to the table to make sure we can create a compelling experience.
Yeah.
Yeah. No, I mean, that's actually been, we're lucky in the sense that one of our co-founders is from an academic background, right? So he has a whole host of colleagues that he's worked with for years. So with that, we essentially have a tool that they use, right? They offer that to their patients. So they've been able to take that and use it in a ton of different areas that we would not have gone into. So right now, we're actually looking at research in late-stage HIV patients, looking at the cognitive function that they have, and can we improve that and reduce the decline by helping them sleep better, right? So that's been absolutely fascinating for us to have researchers come to us and say, look, we think that we could use your tool in this really interesting way. And we're always like, yes, please, that's great.
Right.
That's the most exciting. I agree.
So that's been a really nice way to do it. It's made it very easy for us. So.
Talk about how what you're learning in the work that you're doing applies to other people who might be doing more traditional health measures or health interventions. Sometimes you see the words behavioral health live over here and mental health live over here as if they're entirely different. I got very excited about that. But talk about how, as it came up in the keynote this morning, that we have to figure out how to engage people in all of these solutions that we're offering. And that's really about understanding how people think and what people feel about their health. And that's not so different from treating anxiety and depression. Yep. In fact, those things should all live in the same world. So talk about how you see the work that you're doing informing what other people here might be developing that are more traditional health-focused outcomes.
Yeah, I mean, I think from our perspective, being able to work closely with academics on the research is critical. Developing the evidence base behind everything we do is sort of central to how we think about things. And from our standpoint, that thinking about as you develop things, where are you going to get the evidence to prove that it works? Because we were talking about barriers earlier. Like, we have to recognize as technologists that we're coming into a world of healthcare where pharma set the stage, years of evidence, right? We can't just walk in without that. So that I think for us is the most important thing, is to use the measures that they use and they use in their everyday work. Bring that in and use that.
Despite their shortcomings, yeah.
Yeah.
We'll go there.
Yeah.
No, I think that's right. I think that's exactly it. And I think the only thing I would add has been, it's a paradigm shift, right? The Healthy Heart is another great example. It's digital Framingham heart study, 1 million patients, at least intended goal in the system. It's a completely different mental model. We often talk about building and creating one of the largest mental health studies and databases in the world. You can run research now in a completely different way. And so you may actually be able to compress some of the time frames by just the magnitude of the information that you're collecting, the n sizes that you're powering. We're running a study right now called Mood Matters, and it's amazing how quickly you can actually get some pretty powerful results. We're doing some work at UCSF actually with Dr. Pat Arian, who used to be here, with the Brighton study, and fully all online, informed consent, 500 patients recruited in under a month, no clinician in the loop, delivering digital support, digital therapies through Ginger.io and a couple of other programs, and about to publish some of those results. And so, I do think, while I agree, we definitely need to be inspired and build off of what's existing, there's also a chance to rethink a lot of it. And I think the partners that appreciate that, both sides, because I think, like you, we kind of came from the lab, and we appreciate that it does have to be a real study to actually draw the right conclusions.
Yeah, but I think that point's great in the sense that the way we can now recruit people online is changed everything. Like, we did a placebo-controlled study recruiting online. When we delivered to employers, like, we've also actually done a randomized controlled trial with the employers because we were able to do that really easily. Yeah. Just informed consent online, suddenly the work that we did with them is going to be written up and published. So it makes it a lot easier.
So I have to ask you, because the Institute on Aging works with obviously older adults and individuals with disabilities, and we worked with a lot of very disenfranchised folks from lower socioeconomic places who don't have a lot of access to technology. Talk about where what you're doing fits in to older adult care now, as opposed to often what I hear with this is, well, we'll wait until the baby boomers are the older adults and then a lot of this will apply. My own perspective is we can't wait. We have to figure out what to do now, how to reach people who are homebound and with limited technologies. What do you think your work is doing to sort of change population health for older adults?
Yeah, I mean...
I saved the easy questions.
With a minute and a half left.
Yeah. Foster, you can. Actually, believe it or not, like, sleep is an issue for old people, right? It gets worse with age. And they're actually some of our best users of the program, right? They're actually the people who stick with it, don't jump off with other things to do and get busy. So actually, our outcomes with that particular group are fantastic. We designed the program for, as we call it, the sleepy mind. So it's nice and easy to use. So actually, they do pretty well on it. Access to actual technology is critical. So if they have a smartphone or just a desktop, right? They have a desktop, absolutely fine. You don't need a smartphone for us. So.
Yeah, it's a great story, and I think similar. We've been seeing some really strong participation, across age demographics on both ends of the spectrum, as well as doing a lot of work now in Medicaid populations and federally qualified health centers. And I know we were talking a little bit on the pre-call about deployments in more rural settings, and seeing that smartphone penetration actually even hasn't been an issue. It's roughly 75% now in most of those deployments, which was higher than we had even anticipated. And so it's feeling like the platform is there, but there's definitely a computer literacy question. And I think, like you've described, Dickon, we also have been thinking a lot about how to make this as easy as possible and as simple as possible for anybody who's using it, irrespective of age. But it's definitely an important part of this story.
Absolutely. Last thing, you want to make sure that people walk away knowing about what you're doing or what we should be thinking about moving forward?
I think broadly for us, it's sleep. We think sleep's important. It's a great way to address a number of different issues.
Okay.
We weren't sure who was in the audience. So certainly, if there are any potential employers, risk-bearing health systems, and the likes, we would love to chat. We also believe that mental health is critical to addressing bending the cost curve for core chronic conditions, and it's something that we need to address today. Can't wait.
Great. Well, thank you so much for having us.
Really, really interesting. Thank you so much. Thank you. Great session. See, we can't all go it alone. Sometimes we think we can do it on our own, and it really comes down to relationships, partnerships. It's why we spend so much time at the summit talking about this and trying to inspire you to think about things a little bit differently. Potentially, you might already be thinking about all of this stuff.